Hi, everyone, and welcome back to the Original Medicine Podcast. Today's episode is going to be a little bit spicy. I want to get into why I think insurance is such a bad idea for acupuncture. And before we do that, first, I want to acknowledge why insurance is good for acupuncture. It expands access, right? You already pay for insurance. I'm based in the US. I'm talking about a US-based system. And the best case scenario really is that you have insurance through your employer, which is becoming a luxury these days. So things are really sideways with the healthcare system in America in general, and especially the insurance system. So I'm not trying to dismiss the fact that we're already paying like a lot of money for our insurance premiums every month. So we want it to cover things. This is helpful for so many people, and it does expand access. My first experience with acupuncture was through the University of New Mexico when I had health insurance through the university. And so I went and got acupuncture for the first time ever, not knowing anything about it, being actually terrified about it. And it didn't cost me anything beyond what we were paying for our health insurance at the time. So this was a tremendous benefit to me. And so I definitely absolutely acknowledge that, where if something is no cost or low cost, people might be willing to try it even when they don't know what it can do for them. But the bulk of this episode, what I'm going to get into is why I think it's really a bad idea overall. And I'm also going to, at the end, talk about some suggestions that I have for making acupuncture low cost without diminishing its power, really. Like acupuncture and Chinese medicine as practiced prior to TCM is incredibly powerful. And I'm sure other complement channel practitioners can attest to this as well. But I've had so many patients with all kinds of diagnoses and presentations that Western medicine would say is untreatable. Like, we can't do anything for this. There's nothing that can be done, or you have to have surgery, or you have to have hair implants, or whatever the case may be, right? I've had someone with alopecia areata, like, regrow their hair in about 3 months. I've had people with Hashimoto's, like, reverse their symptoms and have no markers. So I've seen things resolve with the power of Chinese medicine. And I think that it is incredible. And I want everyone to have access to it. And what I see happening is that acupuncture school is very expensive. We are in for the same type of debt in most cases that medical doctors are, but there is not an infrastructure that allows us to go into a practice and gives us a salary, okay? So what I see happening is that acupuncturists come out of school saddled with debt, and we've got to figure out how to run a business. So not only are you a new practitioner in the medical sense, but you're also now a new business owner. Acupuncturists then are put in the position of taking insurance and being reimbursed at very low rates, which makes it very difficult to practice in the way that acupuncture was intended. Not multiple people at a time, but one person complete the treatment, let that person leave, a new person comes in, right? Like, this is not something that we see in the acupuncture model. It is very rare these days to find an acupuncturist who sees one patient per hour. And often when they do, they are a direct pay model. They are a cash-based practice. So what I was saying about getting out of acupuncture school and going right into practice that becomes difficult is that you have to make a living. Not only do you need to support yourself, but you also need to pay your rent at your office. Like, you now have office overhead. And this is really challenging. And I think it is made worse by the fact that acupuncture reimbursement is so low in many cases. And the other thing about insurance reimbursement for acupuncture is that it is highly variable. So there are some insurance companies that will reimburse, $40 for a treatment. And then there are others that I've heard people say, well, I make like $120 for this treatment. Perhaps more, it depends on your market, right? But the point being that that insurance company is not taking into consideration your needs as a practitioner, both personal needs and for your business. But if you decide as a practitioner to take insurance, then you're at the whim of the insurance company. What will they pay for? And also, what will they pay? So I had a conversation with an insurance company very early on in my practice where they told me that cupping was a physical therapy modality, and so they did not pay for that when an acupuncturist billed for it. Now, I use cupping very differently in my practice as well. I don't often just put cups on the body and leave them there to rest. only when people come in with a cold or cough, like upper respiratory congestion, that kind of stuff. This leads me into my second point about acupuncture. But what I'm trying to say is an insurance company will then be the thing that decides what is covered for an acupuncturist. And I, for one, did not go to acupuncture school to have somebody else who's not even an acupuncturist tell me how to practice. And I think that this is shared amongst acupuncturists who don't take insurance. I think this is also a shared feeling amongst Western medical doctors who move to a cash-based practice, direct pay, or a membership, some sort of alternative structure, because they're tired of getting rejection. They're tired of having to get things approved for their patients that they think are best. It just becomes like really a second job. And for me, when I had these conversations early on in my practice, I just felt like, number one, I was going to already have done the work of seeing the patient. Then I was secondly going to have to do more work to send in the billing. Then I would potentially have to dispute what was reimbursed or not. And then fourthly, I would then be in the position, if an insurance company refused to pay for what I billed for, I would either have to eat that cost, which means I don't get paid, or it means that I have to go back to the patient and say, hey, your insurance company did not approve XYZ, so now you owe this. The acupuncturist that I used to see in New Mexico told me stories of his practice with insurance, and he does take insurance in his practice. And there were many cases of where an entire family was covered under the same insurance plan, but yet they rejected the acupuncture claims. They only paid for one person. So he's done 3 treatments for 3 different family members, and now he's only going to be paid for one. So that's not money or time that he can get back. Meanwhile, he has a wait list in New Mexico. So there are other people that could have gotten in that spot, and that's revenue that he's lost. Maybe I should have started off with this. Is the only thing we care about money? That's the most absurd thing I could ever even imagine, because no one who only cares about money would become an acupuncturist. There is literally almost anything that you could do for a profession would make you more money than being an acupuncturist. I could be a nail tech and make more money than I make as an acupuncturist. I'm certain of it. So let's just get that out of the way right there. The discussion today is really about how insurance companies are bad for acupuncture because of the ways in which it changes the way acupuncture is practiced. And a lot of that, the majority of that, comes down to the finances of it. When an insurance company decides how much an acupuncturist will make, what will be covered, it necessarily dictates the way that an acupuncturist is going to practice. So, as I mentioned before, originally acupuncture was one-on-one. What people are taught in school is that in China, they see many patients at the same time in a community type setting. There might be 20 people sitting in folding chairs down a hallway, and everybody gets the same treatment. Perhaps they get different treatments, who knows, but it's all done in a group setting. Yes, that is true, but that's TCM. TCM is not actually true acupuncture. TCM is a version of acupuncture that was created in the 1950s from a small percentage of the system of acupuncture. So prior to TCM, we were working one-on-one with people. It was more shamanistic. Sometimes needles were used, sometimes needles were not. But the point is, modern day, if we fast forward, we are at the whim of an insurance company when we decide to partner with that insurance company. So they are the ones telling us this is what we will pay for, and this is what we will pay you. Sometimes you don't know what they're going to pay you prior to getting paid, right? Because they can always change their mind. And a single acupuncturist has literally no power over an insurance company. So you're at their whim, depending on what they decide on that day. I have not had insurance coverage for, since that initial experience with acupuncture. So I don't know this from being the patient having acupuncture coverage, but from friends who had acupuncture coverage and then had it denied. Same thing. Now they were on the hook for 10 acupuncture treatments that they saw an acupuncturist for. Now their insurance company has changed their mind. Okay. So either they pay it or the acupuncturist doesn't get paid. And it puts everyone in a bad situation because no one wants to have to pay for 10 sessions of anything all at once. But at the same time, should the acupuncturist now not get paid because a company that you contract with, you as the patient, decided not to pay out? It's just a really bad situation. And as I mentioned, this same acupuncturist had issues with a family who had been seeing him for years, who had coverage, who had, acupuncture specifically, explicitly on their their stated coverage. But then the insurance company decided, well, we're only going to pay for one of them. So these things, they set up a bad parameter. Okay. And again, back to my point about how it influences practice. If you might only make $40 from this patient, can you afford to spend an hour with someone only for $40? Not only do you have to support yourself financially at home and your family, but you also have to pay an overhead for your office. And that is something that is very much new to the general population because most people are not self-employed. Most people go to a job in an office or they work from home and they get a paycheck. So it never crosses their mind, as it shouldn't really. But people don't think about this. So when your acupuncturist is charging you $30 for a treatment, or even $60 a treatment, I don't know how an acupuncturist can stay in business with rates that low, okay? Because that's not money in their pocket. That's money that goes to the business to support the business. And then hopefully you make some money at the end of the day. And I worry that accepting insurance, while it does grant greater access to the public to acupuncture, it reduces the quality of acupuncture treatments because acupuncturists, often who are taking insurance, are seeing multiple patients per hour just to make their rent, just to make the business side of it work. So if you see, even if let's say an insurance company reimburses, I'm totally making this up, $100 per treatment, and you spend 1 hour with that patient, you have only made $100, okay? If you run 3 rooms at a time, you've now made $300 from 3 insurance patients, right? That is more livable, okay? But every person that I know who sees multiple patients per hour and takes insurance is exhausted. They're burned out and they just are feeling like, I can't keep doing this, because this is my second point. Western medicine is not working for anyone these days. It's not working for patients. It's not working for doctors. Doctors are fried, they're burned out, and their patients are burned out and unhappy as well because they're having to call insurance companies to get authorization, to appeal denials. Like, this isn't covered. Oh, now this covered at a different rate. It's such a fucking hassle. And the person has already paid their premiums and now they're trying to use the service that they paid for and they're having to go through all this rigmarole, right? So if we as acupuncturists move into that same model, the model that's already not working for medical doctors, the model that's not working for patients of Western medicine, the model that is pushing people to alternative treatments like acupuncture, what stands to reason to happen? We are going down the same path as Western medicine, where acupuncturists are getting fried. Patients are not getting good care. They're getting moderate, okay care. They're not getting excellent care. We stand to burn out in the acupuncture profession if we allow this to take hold and not be aware of what it's doing to our practice. Okay. And thirdly, what I want to talk a little bit more about is how taking insurance in the acupuncture world stands to lower the bar of acupuncture. When we take continuing education classes, I'm self-employed, as are the vast majority of acupuncturists. We pay for our own continuing education. We also pay for travel to the place. I always have to stay in a hotel or Airbnb. I have to feed myself when I'm gone, right? These things are just part of doing the practice, right? And I love going to continuing ed. I love deepening my understanding. I love being a community of people that practice the way that I do, who are really committed to a deep understanding of Chinese medicine, who want to deliver the best possible treatment that they can for their patients. I love that so much, but it is an absolute expense, okay? In other parts of the world, people are also doing this, and they're saying, when you deepen your skills, when you up level, then you raise your prices. If you are an acupuncturist, if you're going to an acupuncturist who takes insurance, you are never able to raise your prices because the insurance company decides what you will get paid, period, end of story. There's no petitioning to them, hey, but I have taken this many courses, I've spent this many hours studying, I've really deepened my understanding, and therefore the results that I get from my patients are even better than they were 5 years ago. There's none of that consideration. There's just, did you see a patient? Did you bill this code? By the way, there are only a couple of codes that acupuncturists can use. And then if so, here's what we pay you. Done. This is all we're talking about, an insurance company paying for acupuncture. So I think it's really important for the public to understand these concepts, because when you are going to an acupuncturist who takes insurance, it is highly likely that you are not getting the level of care that you could get. And that's obviously not the case in 100% of cases. But again, I will say from my experience going to acupuncturists that both had cash patients, and I was a cash patient, as well as taking insurance, my treatments were not as good. It didn't mean that I didn't get better, but it took longer. The same treatment in a focused, intentional arena could have gotten me well much faster. And that's what I see in my practice. I don't take insurance. I've never taken insurance. I'm direct pay. And I think the reasons that this gets better results is because patients are more invested in their healing. When you have to pay out of pocket at a higher rate, when you are working with someone who is entirely focused on you for that full hour or that full whatever the time is, they're only focused on you, and you know that someone is serious about your healing. It's not put needles in and go to the next room and talk to the next patient about their childhood trauma, okay? It's full intentional treatment focused on the patient. And I see that my patients get better faster and get better for longer. Like they don't have to come back. They're good to go. I talk to them later. They say they're good, right? Because of that intentional focus. And I think that when we start down the path of taking insurance, we intend to be focused on their care and take the burden of payment off of them and have the insurance company pay us. Those are all good things. But then we start to realize the insurance company is not paying what we thought they were going to reimburse. So now we've got to start putting multiple patients in our clinics at the same time. We can't just work with one person per session. We've got to put needles in and then let them rest and go to the next person. And we're doing that to survive. And on one hand, we're thinking to ourselves, well, some acupuncture is better than no acupuncture, right? I don't know if I agree with that necessarily, because overall, we're getting like a watered down version. That's always my concern, is how what we're doing in the profession, what we're doing in school, what we're doing with the way we run our businesses is watering down the practice. So patients are getting some result, otherwise they wouldn't come back at all. But the other thing I want to say about that is I think that people are so rushed and stressed in their daily lives that just simply slowing down for 30 minutes or an hour and talking to someone who is genuinely concerned and caring toward them, I think that is as much healing as the actual acupuncture in a lot of these settings. So imagine if we take that focused time and we're focused intentionally on our patients, we're concerned and we're caring toward them. But in addition to that, we are doing a deep level treatment. We are truly focused on the level of energy that needs to be focused on. We are truly focused on giving them proper dietary recommendations. We're focused on their mindset. What are the thoughts that they're having that are generating or contributing to the health problem that has brought them in? What are the things that they're doing in their life? Did they just install a sauna in their house and they sit in it every day? That's a disaster for people's health. And if we don't have time to talk about all the things, the whole scope of their lives, we can't deliver optimal results. We can deliver okay results. But I'm personally not okay with just okay. I always want to be the best. I always want my treatments to be the best. I want to know how I can be better. And I know that not everyone shares that. And even the patient themselves may not share that. They may just be okay with the okay. And if so, that's great. But I just think that this conversation needs to be had, and we need to be thoughtful about the ways that insurance affects our actual practice. If I could practice the way that I do so often, my treatments could be reevaluated to somehow demonstrate that I am deepening my practice and my abilities as a practitioner, which translates into better and better results for my patients. And therefore, an insurance company would raise my reimbursement rate. And if I didn't have to spend whatever the potential time is billing and hassling with an insurance company, I think that I would absolutely be okay with taking insurance. But what I see happening is not that. It's people, acupuncturists, not getting paid for the work that they have done because the insurance company is denying it. In many cases, it's not even a technicality. It's just a whim. Oh, we changed our policy about that. Well, you didn't let your patient, you didn't let the consumer know. Now the patient doesn't know and you didn't let me know. So now that means I'm not getting paid for all these hours that I've worked, right? All these treatments that I've given. And I think that's a really unfair thing, but I think it's really detrimental to the practice of medicine. So in conclusion, I want to make a suggestion for what we as acupuncturists could be doing. I think instead of running our clinics like nonprofits and barely squeaking by, giving treatments, I mean, I personally give treatments for free, but I charge a rate that is higher than a lot of my colleagues because I practice something that's not practiced by most of my colleagues. And when I say colleagues, I mean other acupuncturists. I don't mean people in the complement channel realm, but I feel that my experience, my expertise, my results are good enough to charge what I need to be charging. I realized as an acupuncturist, I have more education than an attorney, but I make less money than a plumber or a nail tech, or actually a lot of people. And that's not to put down a plumber or a nail tech. I think both of those professions are amazing. And I'm kind of at times wishing that I would have done something like that. However, I love practicing Chinese medicine. And I'm simply saying that if a plumber can charge more for a 1 hour visit, not even a 1 hour visit, it's sometimes like 20 minutes to your house and they have something fixed for you and there's like $150. The majority of acupuncturists are not charging $150 for their sessions. And I think that that is absolutely absurd. Do I think that you should, as an acupuncturist, should be out here giving mediocre treatments and then charging more? I absolutely do not. But what I'm saying is that when the culture thinks that insurance should cover acupuncture and acupuncturists should take their insurance, what they are doing is contributing to a framework that reduces acupuncture to the same thing that Western medicine is, where it's just patients are in and out. Western medical doctor might be seeing 8 patients an hour. Like, it's so quick. You have no time with your doctor. You don't have time to get any kind of lifestyle counseling. They don't know what's going on with you. It's just like a quick evaluation of your symptoms, writing a script or a referral for other tests. And like I said before, medical doctors, some of which are my patients, are absolutely worn out. They are burned out. And what they love about doing their job is killing them because it's being run by an insurance company. The hospital administrators are running clinics and running hospitals, and they're running doctors into the ground. And I think the same thing is beginning to happen in the acupuncture realm as acupuncturists have to adapt to a model driven by insurance companies. So I think that in our communities, acupuncturists could band together to run a free community clinic or a very low-cost community clinic. I think we could partner with community centers and or churches, anywhere else that has space available that is not always being used, like it's not constantly in use, like a church, for example. We could make a low-cost or free community clinic. We could band together to advertise this so people that cannot afford our private pay, our direct pay, our cash rates could come and get treatment in that way, okay? And we could all take turns per month. We could volunteer our time, because in our practices, we're charging good rates and we're seeing people, connecting with people who can not only afford to pay those rates, but value paying those rates. Because again, people, there are folks out there who are paying $200 to get their nails done, but then they don't want to pay you $100 for an acupuncture appointment, right? Like, this is not acceptable to allow the public to decide what you do and don't charge, right? Because we are going under as acupuncturists in doing this. Again, my proposal is that acupuncturists could get together in their local communities and volunteer their time to help people who cannot pay for these services. And I think that we could cover a lot of ground that way, because what is happening is a lot of acupuncturists are going out of business. They're not able to keep their heads above water because, like I said, there's a lot that goes into just maintaining an office, much less being able to support yourself. And I think that that becomes very difficult to do when you can't charge rates that are appropriate. And also, like I mentioned before, considering all the things that go into becoming a better acupuncturist. There are some states that don't require continuing ed. So it's possible that there's some acupuncturists, practicing in the United States who never take continuing ed. I certainly don't know those people because I'm not in that circle, but it is possible that maybe you could just get your license and practice however you want for the rest of your time on the earth. But the people that I know are heavily investing in their continuing education. And if they're not able to raise their rates, they're literally losing money like constantly. Like there's no way that they can keep their head above water. So I'm really in favor of practitioners who are heavily invested in their continuing education, who are constantly striving for a higher bar, who always want to give better treatments, and who are investing in doing so. And I think those people should be able to charge rates that reflect their dedication to their craft and to the medicine, while also acknowledging, obviously, not everyone can afford these rates. So we can band together and make a community clinic that serves the public in a different way, as opposed to accepting low insurance reimbursement, because that just leads to practitioner burnout, just as we've seen it lead to practitioner burnout in medicine. The physicians I know say they don't know how much longer they can keep working in this way. I mean, obviously that's going to have devastating consequences for everyone that it's happening in the Western medicine realm, but I don't want to see that happen in the acupuncture realm. And I do believe that it's beginning to happen already. So I genuinely hope this episode has been enlightening. I'm sure this is sort of the underside of a profession that you probably never considered before, but I hope it helps shine some light onto what I think is a significant problem in the acupuncture profession, and hopefully also like my ideas for solving the problem can be helpful to someone listening. So thank you again. This episode is going to be my last episode in season 1. I'm going to take a little bit of a break, and then I'll be back for season 2 at a later date. If you can please hit that follow button, it really helps a lot. I appreciate you listening and sharing this with whoever you think could benefit. Take care. Bye-bye.